Hace unos años, hace 3 años, comenzamos a trabajar juntos para que Europa...
About 3 years ago, we began working with European countries to have them join this marvelous initiative of Vaccination Week in the Americas, which is now 6 years old. We discussed in particular the goal of measles elimination, and also ways to increase social participation and the role of the media to help broaden vaccination efforts and take immunization to all, not only to children, but also to families. This is important because we now have new vaccines, such as influenza vaccines for the elderly, vaccines for adult women and men, and of course new vaccines for children, in addition to the traditional ones. All this was very favorably received by European governments, and with the leadership of the World Health Organization, we have now chosen the 3rd week of April for a joint launch date including 2 regions, Europe and the Americas. We hope this will be followed by other regions, and that under the leadership of WHO Director General Dr. Chan, we will in the near future fulfill a very beautiful dream, that of a World Vaccination Week.
Tengamos en poco tiempo un sueño muy hermoso que sería una semana mundial de vacunación.
Many people believe that immunization is not useful anymore. They are wrong, and this week to promote the immunization, basic immunization, shows how much we are neglecting a fantastic tool to protect children in particular and to prevent terrible illness. In my region, in Europe, 53 countries, there are 32,000 children dying from illnesses that could be totally prevented. So it's an enormous loss of life which can be easily prevented. So that's the message of this week. You parents, you health professionals, you need to stimulate, to promote, and to do the necessary immunization, vaccination. And we are doing that in WHO, in the entire World Health Organization. And I would like to try to say it in Spanish because our partners are Latin America. Somos todos unidos, somos todos unidos para la vacunación.
I'm very happy to have this occasion to join the 2 regions of the World Health Organization in supporting their work on the Vaccination Week. I think, I need to recognize the leaderships of 2 regional directors, Dr. Mirta Roses from the Americas region and Dr. Mark Denson from the European region. What they have been doing in the last few years is a tremendous effort to work with countries and support countries in promoting vaccination. Vaccination is extremely important. It is one of the most cost-effective interventions to prevent diseases, and in some instances to prevent deaths, because diseases and deaths are so unnecessary when we have the instrument, the tools, or the means to prevent suffering. So their efforts should be recognized. Having said that, I also would like to commend member states, the countries in these 2 regions, for their investment in terms of financial input, as well as mobilizing their healthcare workers to support this effort to reach out to very difficult to reach populations, to reach out to disadvantaged or marginalized and high-risk group, so that everyone can have the chance to be vaccinated, to stay healthy. And the objective of this Vaccination Week is to promote equity and access to vaccination. I think this is extremely important, and this objective is in keeping with what WHO is doing. This is our core business, this is our core work, and I would appeal to countries for their ongoing effort. This vaccination program not only important to prevent diseases on an individual level. If the coverage is good enough, it also has a community benefit, because if they manage to cover high population of people, they can prevent the transmission of diseases between people. And also, this vaccination initiative is helpful in building their own immunization program and helpful to reaching out to those people in need. And all in all, this is an initiative that we would strongly support in the organization. Again, congratulations to the 2 regional directors and to all the countries in the 2 regions. And on behalf of the people in these 2 regions, a job well done.
United for Immunization.